Person-centred care means tailoring the support for an individual to suit their needs and requirements. While care is sometimes thought about as simply administering the correct medication and treatment to an individual, person-centred care encompasses a more holistic approach to support and takes into account the individuality of a person, their beliefs, their preferences, and their dignity. It's important to embed person-centred values when providing oral care to support individuals to make informed decisions about their care and treatment. Working this way can help reduce the risk of negative, unfair, or harmful treatment to clients. At the heart of a person-centred approach to care is respect for the individuality of a patient. Everyone is different, and there is no one-size-fits-all. There are many factors to consider when thinking about a person's individuality. A person may have deeply held cultural, religious, or political beliefs that will affect how they wish to be treated. They may also have more nuanced personal idiosyncrasies and routines that are important to them. Being mindful of these helps the patient feel comfortable, respected, and dignified. Undermining a person's autonomy, beliefs, and choices can be a cause of considerable distress. If a patient's dignity is not considered, it can easily lead to the patient feeling anxious and untrusting of the caregivers. It is important that a care worker does not make assumptions about how a patient would like to be treated. Maintaining regular communication helps to foster an atmosphere of trust between the patient and the care worker. It may be the case they feel that their neglect of their oral health is unwise, but this may be the result of underlying issues, such as a lack of self-worth, depression, or a distrust of medical advice. If a person feels disrespected, it is likely that they will become increasingly less trusting and less receptive to opinions of dental professionals. A large part of helping individuals to feel dignified and respected is to empower them to take an active role in their own oral care and not impede their freedom to make decisions for themselves. Unless an individual suffers from severe cognitive impairment, it is important that they choose plans for their oral care that they feel are appropriate for them. Providing honest information and communicating the information clearly is essential to help patients make informed and wise decisions. It is important to consider how each individual will respond to the information they are given. It is not always possible to fully empower a patient to make decisions for themselves. In cases where the individual suffers from neurodisabilities, mental illness, or dementia, they may be less capable of decision-making. Where this is the case, it is important that support mechanisms are put into place to ensure their wishes are adhered to. A patient will often be much more receptive to goal setting and willing to take personal responsibility for their oral care if they are taking an active role in their treatment plans. Considering a patient's individuality, treating them with dignity and empowering them to make their own decisions all leads to a sense of independence. Promoting independence enables the individual to carry out activities that they can do by themselves, for example, brushing their own teeth. Wherever possible, it is important to instill that sense of independence because it will positively feed back into their sense of individuality, self-respect, and empowerment. An important goal of care work is to enable a patient to help themselves when possible. Over-dependence on the care worker diminishes their capacity to attain a sense of self-worth and purpose. This, in of itself, can be considered as a disability, as it is likely to cause a negative feedback loop of self-doubt and a lack of self-worth. If a patient does suffer from cognitive decline or mental illness, it can be difficult to tailor care to suit their specific needs and wishes. A patient may be confused about information they are being given or anxious about the care workers themselves. Family and close friends of the patient can often help to reassure trust in the care worker's intentions. Often, they will be able to better communicate the patient's needs and wishes. This will help to establish a better working relationship with the patient and care worker. In many cases, family members can provide consent on the patient's behalf, but it is always important that laws, policies and guidelines are followed. Wherever possible, actions and decisions taken on behalf of the patient should be documented. The Human Rights Act 1998 is the main legislation that sets out the rights of people in the UK. This Act protects and respects individuals' rights, the right to be kept safe from harm, the right to be treated with dignity and respect, the right to speak your mind and the right to life. While most citizens would agree it is a moral duty for a care worker to uphold the well-being and dignity of a patient, it is also the law. Negligence to the safeguarding of a patient or abuse of a patient can lead to serious legal repercussions, including prison time.